lower GI bleed, what is known as?
Hematochezia.
Hematochezia. Okay. So, what is the cause? Colonic causes. Colon which cause lower GI bleed. Okay. If massive, just tell me one in colloquial language, what is the cause of lower GI bleed?
Hemorrhoid.
Yeah, in colloquial language.
Fissures.
No. Hemorrhoids. What? Yeah, piles. We call it as piles, right? So, piles or hemorrhoids will cause lower GI bleed, but it is very minor. Minor, most common. It is a minor and most common. If you want massive bleeding, then it is due to diverticulosis. It is due to diverticulosis. Okay? Yes? No?
Yes, sir.
And
small bowel.
Small bowel causes angiodysplasia is the most common cause. Angiodysplasia. Okay? Only 3 points. Just remember. If the patient is having lower GI bleed, it may be from colon. It may be from small intestine. If it is from colon, if it is massive, then the reason is diverticulosis. If it is minor, then the reason is piles, hemorrhoids. If it is from short bowel, small bowel, then it is from angiodysplasia. Okay? So, yes, no?
Yes, sir.
Yes, sir.
Okay. So, a patient comes with hematochezia to your OPD. You are sitting in your OPD. A patient comes with lower GI bleed. Sir, I have passed blood in my motion. So, what you will do immediately?
Proctoscopy.
Very good. So, the first test is do a proctoscopy. You do a proctoscopy. I think I have the image of proctoscopy. Okay. You have seen that proctoscope, right?
Yes, sir.
It will be somewhere something like this, and it has an obturator in the center. It is just inserted, and we'll take out the obturator, and we'll see. That is a proctoscopy. But the investigation of choice is colonoscopy. What is this colonoscopy?
Examination of the colon.
Yeah, examination of the colon and bowel. Okay. So it is an endoscopic technique where we insert a bowel through the anus into the rectum, and we visualize the colon here. Okay. So the patient had, see, one patient comes to me. He has lower GI bleed. I put a proctoscope. He has hemorrhoids. I have sent the patient. Okay, hemorrhoids. I have written the treatment. I have done surgery. I have sent that patient. Gone. Second patient comes. I did a proctoscopy. I am not able to find the hemorrhoids. So I did a investigation of choice. What is that? Colonoscopy. So I found in colon diverticulum was there. I have treated the diverticulum. Sent. Gone. Third patient comes. He has lower GI bleeding. I did a proctoscopy. Nothing was found. I did a colonoscopy. Nothing was found. Then what to do?
Contrast.
Contrast. Is having lower GI bleed. Colon is not the source. I have examined up to colon. I cannot see the small bowel, but I have examined up to the colon. So after that, what to do? I have stuck there.
Scan.
You
Do we
think
scan,
logically?
sir?
Isotope induced scan.
Sorry.
Isotope induced scan.
See, this is the colon. My scope is going till here. I have examined nicely. Nothing is there. Above, up to esophagus, I have esophagus, and up to duodenum I have seen. But there is a way. Is there a way to look into the small bowel? Yes, no.
No,
We don't
he
have
said
that much
no.
tiny scope to pass, and we cannot negotiate it right from outside. So, is there any
Yes.
way to look into the small bowel? That's what is my question.
So we do a scan.
Scan. we cannot pick up a small lesion
Oh.
inside the bowel. Scan is okay, but we cannot pick up. We need a much finer instrument, that is nothing but a capsule endoscopy. Capsule endoscopy. We give a small capsule. It's a video camera. Okay, a small capsule. It is available. It's not a very costlier or very rare investigation. We give a small capsule which has a small endo camera in it. The patient will swallow it. Okay. So after some 6 to 7 hours, it will go into the small bowel. From there, it will start capturing pictures inside the small bowel. Okay, it has 360 degrees view. So it will capture all the images in the small bowel, whether any small bowel lesion is there or not. And afterwards, the next day we'll collect the motion and we'll take it out. Okay. So this is nothing but it is known as capsule endoscopy. Okay. Got it? This is a technique
Patient
to
swallows the capsule. I mean,
Yeah,
the
it just-
camera.
yeah, it is just like our tablet, just our what we call it as our capsule. Some
Okay,
ordinary
sir.
capsule. It is just of a 1 centimeter size. That's all. Okay. Which has an inbuilt camera, inbuilt battery system. Everything will be there in that small camera. Capsule will be there. So he'll just swallow it. Nothing. No wire will be there. Nothing will be there. It will just take the images, and once he will pass it through the motion, we'll collect it. We will decode it. So we'll get all the information of the small bowel. That is capsule endoscopy. Okay. Just you can search in your Google also about this capsule endoscopy, so that if they ask an image, I forgot to put the image, they can ask an image based questions. What is this and what is this for? This is capsule endoscopy, and this is for identification of any lesion in the which bowel?
Small ball.
Small bowel. Yes. So that is done. And if lesion is identified, it just identifies the lesion. There is a small bleeding point in the small intestine, but it cannot do anything. Where it is, we cannot see. Just if it goes there, it will just tell somewhere it is bleeding inside. That's all. So then we will do a RBC tagging scan. RBC tagging scan. So some RBCs are taken from the patient. They will be tagged with technetium. They will be tagged with a tracer, and we'll give it to the patient. Okay, these tagged RBCs, if they go and bleed, we can find it with the help of a gamma camera. Okay, and then as you told, we can give some contrast to localize it, and we can do an angiography to stop it. This much procedure is there for small bowel bleeding. Okay, so see how simply it started. The patient came with piles, we treated. The patient came with a colonic lesion, we treated. But if some cases, it is very difficult to treat a lower GI bleed. Okay, upper GI is amenable. Just put a scope. If it is okay, if it is bleeding, you can just cauterize it. If it is not bleeding, just open the abdomen and close it. But in small bowel, can you just open the abdomen and close it?
No, sir.
Why?
It is very difficult to open.
Yeah, it is very difficult. There is 6 meters of bowel. You don't know where it is bleeding. Okay, so you will be stuck there only. It will take 3 days for you to identify each and every part of the bowel. Okay, so always
Trouble with
identify it before.
localization.
Sorry.
Trouble with localization.
Yeah, we have trouble with localization. So spend your time on localization initially. Do a capsule endoscopy or do a tagging scan. Do a arterial angiography. You do whatever you want before surgery. Okay, and if you find any lesion, then you go for surgery. Just pick up that small part of the bowel and operate. Okay, so this is about lower GI bleed.